Hello and warm welcome. I am Connie, the Plan H Delivery Lead. We welcome you to the HPP webinar. It's good to see you here. While we wait, please introduce yourselves in the chat and we'll get started in about 5 minutes. I see several participants are coming in from different regions and we welcome you. Keep chatting, getting in there. Hello, Allison. Nice to see you here. We look forward to a great presentation today and some good Q&A. Thanks to our team behind the scenes for making a lot of this happen. Thanks. Hello, Alexandria. Hello, Ian. Welcome. Welcome, Frank. Look forward to seeing you and doing a great presentation today and Q&A after. So keep popping in your names and locations, maybe the territory that you're on, if you know it. And we'll start in about 5 minutes when we get more people registered. Hello, Charles. And hello and welcome. Yes, if you know your territory, you can pop that in there as well. We're using the chat function to say hello and greetings. Hello, Polly. Nice to see you there. Kim, hello and welcome. Thank you for popping in your territories that you're living, working, and learning on. We'll get started in about another 2 minutes as everybody starts to introduce themselves. Thank you. In the chat, just pop your name in there. This is the HPP webinar. It's good to see you coming in. My name is Connie, the Plan H Delivery Lead. Hello and welcome. Hello, Laura. Hello, Sarah. Hello, Stacy. Great to see the team here as well. Welcome, Isaac. We look forward to seeing you and the presentation today. Thank you for joining us. Hello, Olga. So I think we'll get started. Welcome to everyone who is joining us from across the country. This is the third webinar for BCHC in the Local Government Leadership Series. And today is the Creating Healthy Public Policy, Navigating Public Policy Pathways. At the bottom of your screen, you'll see 3 opportunities for engagement. Today, we're using the chat and the Q&A icons. Please introduce yourselves in the chat and add the territory you're joining from. Thank you for doing that. Please use the Q&A function to send us your questions throughout the talks with the speaker's name if you wish. I will collect them and direct them to our panelists at the end during the Q&A section. Today's agenda, it goes from 10 to 11 with 2 speakers and then a Q&A to go deeper into public policy pathways. I am your host today. I am Dr. Connie Alsop, currently working as the Plan H Delivery Lead for BC Healthy Community Society. We are here with several of our BCHC team members helping behind the scenes to make this all possible. And you may find our bios in the website at bchealthycommunities.ca. A big shout out to several of the communities from Plan H that are joining us today. City of Coquitlam, City of Delta, City of Williams Lake, City of Mission, Musqueam, City of Squamish, the District of Squamish, Richmond, City of Vancouver, and a number of other places. We just thank you for joining us today. I'll do a land acknowledgement once more people have joined us, and then we'll get started. Thank you. It's great to see you all here. It's nice that you're joining in and popping your names in. We had over 200 people register for this, so we were pretty excited that people are joining us from across the country. Big shout out to those that have joined us specifically for one of our speakers today from out west, out east, actually. I guess we're the west. So we have a west and an eastern speaker joining us today. I'll do the land acknowledgement. So BC Healthy Communities offices are located on the surrounding traditional lands, the Tecumseh and the Lekwungen Nation. We live, work, play, and learn. Just a few housekeeping behind the scenes. We hope that the questions will create a lively discussion with our two speakers and pop those into the Q&A function. You're also free to put your learnings and comments in the chat function, as well as you will see resources that are there from our BCHC team and our speakers. We'll also be tweeting today, so please do chime in on Twitter using hashtag PlanHHealthyPublicPolicy and hashtag BCHCHPP series. Thank you for that. We look forward to your comments on Twitter. Just a reminder that the talks and the Q&A are going to be recorded today for your review and sharing with others. It will be up on our site later today when we finish. At the end, you are also invited to complete a survey link and provide us feedback and future topics. And we thank you in advance for making sure that you complete that at the close of our webinar today. First, I'll be sharing a little bit about BC Healthy Communities. BC Healthy Community Society is a province-wide not-for-profit that facilitates the ongoing development of healthy, thriving, and resilient communities. We at BCHC Community Society believe that it is possible and necessary to create communities where it's easy for citizens to be healthy and well. We operate at the intersection of planning and public health. Since 2012, Plan H specifically program serves to support local and Indigenous government in two ways. Support local government through engagement and partnerships across the sectors for healthy communities, and to create with the Ministry of Health ways to support the province health promotion strategies. This section specifically, we are healthy public policy. This policy, public policy, healthy public policies that connect to local governance. Plan H has focused on HPP for the last several years, given that it's a powerful tool for local and Indigenous governments. In short, policies guide the way things get done, and perhaps what's most exciting about that is it creates pathways for systematic change. We are going to need some higher level structural change, some upstream, in order to overcome the current challenges we face, such as poverty, housing affordability, and climate change. Our intent for this session, Healthy Public Policy, is creating the conditions for equitable communities, promote powerful vehicle available for local governments to increase and improve the life of their constituents, establish avenues towards creating higher level structural change, and affirm everyone plays a role in policy process. We are delighted to see a wide variety of audience members attending our series today. The purpose of today's session specifically is insights and tools for those who have the opportunity for creating and influencing public policy within their communities. Policies are used by companies to guide ethical choices, by school districts for how they coordinate with local schools and work with government. And finally, local government uses policies for decision-making. Navigating how to influence policies may feel like a daunting task, but changing policies is even greater. Our speakers today, Florence Morestin and Stephanie Neilson, intend to present key insights into research, case studies, equity, policy windows, capacity building, and the determinants of health to guide your local public policy conversations. We hope that you will enjoy, jot notes, raise questions for our presenters, and ponder one action step that you could take as a result of this webinar. Now, without further ado, I'll introduce our two speakers and then turn it over to them. Our first speaker, Florence Morestin, is a scientific advisor for the National Collaborating Center for Healthy Public Policy. She is trained in political science and community health with a master's, an honors master's from the University of Montreal. In 2009, she joined the center following many years of working in international public health, in which she acquired experience in intervention in the field in policy development, in research, and in knowledge sharing. In her current role, Florence is in charge of knowledge sharing project that focuses on ways to have healthy public knowledge shared and considered in the context of policy development, while she also contributes to the policy project of analyzing public policies. Our second speaker is Stephanie Neilson. She brings a passion for local knowledge, context, and experience to her work in evaluation. Currently, Stephanie is our BCHC evaluation lead. She follows and holds a Bachelor in International Development and Master's in Rural Planning and Development from the University of Guelph. Stephanie has worked both in Canada and overseas for 10 years in the field of evaluation and research. Her experience centers on projects that examine how research influences policy, capacity building, gender, health, as well as environment and resource management. Now I'll hand it over to Florence, who will then turn it over to Stephanie. Welcome, Florence, and I turn the mic to you.
Well, thank you, Connie. Hello, everyone. It's a pleasure speaking at this webinar today. So as Connie mentioned, I'm a scientific advisor at the National Collaborating Center for Healthy Public Policy, the NCCHPP. Next, please, Monica. We have a mandate of supporting public health actors in their efforts to develop and promote healthy public policies, including policies adopted and implemented at the local level. Next, please. We are part of a network of 6 national collaborating centers funded by the Public Health Agency of Canada, located across Canada and working each on a specific topic. Next, please. And the NCCHPP is located in Montreal. So I want to acknowledge that I am speaking today from an age-old Indigenous territory, a place of meeting and diplomacy between peoples and the site of the signing of the Great Peace Treaty. And I thank the Kanien'kehá:ka Nation for their hospitality on this unceded territory. Next, please. Okay, so with my presentation today, I lay the ground for the conversation, and Stephanie will then bring things to a more practical level. So I'll start with a definition of healthy public policy, which I find very concrete. It's the one proposed by Nancy Milio, who wrote that healthy public policy improves the conditions under which people live, secure, safe, adequate, and sustainable livelihoods, lifestyles, and environments. And then she goes on to name a host of sectors, policy sectors that matter in this regard, such as housing, childcare, transportation, community services, etc. So we know that local governments do a lot in many of these areas. The overlap is obvious. Next, please. But overlap does not equal collaboration. You need to make an extra step to make collaboration happen. What helps in this regard is that local governments offer a lot of opportunities for public engagement, especially compared to other levels of governments. So they enable a host of diverse actors to have their say in the policy development process. And when public health actors get a seat at the table, the added value is a consideration of the health and wellness impacts of the public policies under consideration, and also an enhanced consideration of equity, which can result in producing healthy or healthier public policies. So the question is, how does this conversation happen between local government actors and public health actors? Next, please. So I've been studying this topic for the past 12 years through the lens of knowledge sharing. The content of my presentation today is based on surveys and interviews conducted by myself or others with both public health actors and local government actors. Now, when I'm talking about public health actors, I'm thinking mostly public health practitioners in local health authorities, but public health researchers may also recognize themselves in the situations I will describe. And local government actors encompass both staff and elected officials. And we are lucky today to have participants from both sectors. So as Connie said, we really encourage you to jump in, to comment in the chat and ask your questions. And we hope to have a rich conversation at the end. So how does knowledge sharing happen between the sectors of public health and local governments? I've adapted a framework that was originally developed by Levis and colleagues, which identifies 3 points of entry. So this conversation may happen in the context of existing collaborations, or else be initiated by local government actors or by public health actors. Next. So let's look at the first scenario when an ongoing collaboration is already underway. Sustained collaborations, relationships between organizations take years to establish, but they produce the most successful collaborations because of the mutual understanding and the trust that that builds between partner organizations. So in such a context, knowledge sharing happens nearly organically and in a timely fashion. These collaborations may be informal, actually that's how most collaborations begin, or they may be formalized, which does not necessarily mean long-term. If we take the example of the Plan H Healthy Public Policy grants, well, these are one-year grants, but they can be a first step in fostering a multi-sectoral collaboration. Now, that being said, ongoing collaboration is the ideal situation. But if there is no existing collaboration where you work, someone has to take the initiative. Next, please. So when local government actors do seek public health knowledge, it is because they have certain expectations. Oftentimes, they are looking for well-established expertise to supplement their own. They are often very interested about the detailed knowledge of the local population that health authorities possess through their public health surveillance systems. In many cases, they are hoping that their public health counterparts can offer evidence about what interventions will be the most effective. Or as one planner I interviewed put it, we hope that they will bring the proof to the table. In some cases, local government actors are looking for new ideas on how to approach certain problems. And overall, they also hope to leverage the credibility that comes with public health knowledge and use it as a convincing power that they can use towards other actors. Next, please. Most of the time, though, local government actors do not look out for public health knowledge. And there are many reasons for that. One being the lack of resources, especially in smaller local governments, but also overall a lack of familiarity with public health resources, public health issues, public health actors. And it's striking that when local governments work with external partners, most of the time it's with private consultants. So clearly there's something around the accessibility of public health resources and people. And that's why oftentimes public health actors have to be proactive to make themselves known. Next slide, please. So public health actors reaching out to their local government counterparts to share their knowledge is the most frequent scenario. When public health actors do that, it's because they hope to put problems and/or solutions on the policy agenda, or they hope to tweak solutions that are already under review to make them healthier. A note here, offering knowledge that sheds light on how to address a problem that already is on the agenda is usually better received. It's trickier when you try to add a new item on the policy agenda of local government actors when we know that their table is already full most of the time. So that is not to say that it should not be tried, but one has to be prepared to face a bit more resistance. Next, please. Now, sharing knowledge is one thing, but it will actually be considered only if it is deemed relevant. So what is the kind of knowledge that is helpful to local government actors? Well, they hope to receive concrete, specific recommendations as opposed to principles or general ideas. They hope to receive recommendations that are based on local data, ideally, and if not, at least data from similar municipalities. And they are also very interested to hear about solutions that have already been implemented in similar municipalities. And when I'm saying similar, at the very least, it's about a consideration of whether the context of a municipality is rural or urban, because you want to offer solutions or interventions that are that are contextually relevant. Relevance obviously also is about timeliness. I won't delve much into that because Stephanie will talk later about windows of opportunity. Next, please. Now, when public health actors take the initiative, it might be relevant to do so with allies, such as community organizations, citizen groups. Depending on the subject matter, it might be with the local business community, and most of the time also with experts from other sectors, because public health knowledge is just one piece of the puzzle if you think of multifaceted issues such as climate change or the housing crisis. Why form alliances? There are two main reasons. One, because it gives a lot more weight to the message. And second, because there is added value in the complementarity of roles between allies. For instance, public health authorities may not be comfortable engaging in advocacy activities, but their partner community organizations might be. So in such a situation, the local authority offers knowledge and recommendations, and the partner organizations go on to advocate based on this knowledge. And actually, in the networks engaged in promoting healthy cities, healthy towns, most of the time, public health is just on the periphery, and other organizations are on the center of the network. By the way, we're not even talking about, we're not talking either about necessarily formal alliances. A lot of this happens informally. Next, please, Monica. Okay, I'll conclude my presentation with a few words on equity. Who proposes policy options and who participates in their development, or who gets to participate in their development, are serious questions. We have, with COVID, we have witnessed numerous examples of situations when, or decisions that were based on a narrow vision of public health protection, and that did not consider the differential impacts on various population subgroups. So public health actors base their recommendations on research evidence. It's actually one of the bases of their credibility. In this sense, they are constrained, though, by the decisions that are made upstream as to which research topics are relevant. Nevertheless, it is also their responsibility to complement the research evidence with other sources of locally relevant knowledge, or as Zeynep Pamuk calls them, bottom-up sources of knowledge. And that's where, again, there's added value in working with allies such as community organizations. And as to local government actors, they have to be aware of who they invite to sit at the table. And when they do organize open public hearings on how to actually enable participation from the relevant groups, you can see the quotes in this slide. Well, they make, it's quite evident in these quotes that some populations are not able to attend with the current design of many public engagement events. So in this regard, Planet has produced an action guide on community engagement that gives a lot of helpful advice of how to design such events so as to foster participation from a host of groups. And again, the expertise of community organizations can also be leveraged in order to mobilize the so-called hard-to-reach populations that they serve. So I will stop here. My next slides, are a list of the references I've used to build this presentation and my contact information, but you can access that after the webinar. So I'll hand it over to you, Stephanie.
Great, thanks, Florence. And thank you, everybody, for attending today. Adding to what Florence shared with us, I want to speak to where there may be some opportunities to influence or change policy, and then I'm going to speak to what that looks like. So more often than not, the policy process is often depicted as linear, right? You have an agenda, there's policy formulation, decision-making, implementation, and finally evaluation. But in reality, the process is usually messier and nonlinear in nature. And when we take them apart to look at them as units of analysis, it's useful for us to look at the different parts of the policy process. For example, researchers can look at the different alternatives or the policy implementation or evaluate the policy impact. But that can be limiting in how it assumes a rational, almost static way that information or knowledge is produced, used, and incorporated or not incorporated into policy by the policymaker. And it also assumes that the policymaker or decision makers look at all the options. Researchers such as Diane Stone would suggest that more often than not, researchers stop as soon as a workable solution is identified, and that policymakers don't necessarily find or use the best possible decision based on available options, but rather they satisfy the demands of the public. Next slide, please. Can you go back one? And as my former colleague, Fred Carden has noted, close observation of how public policies are actually made and executed lead to a more complicated but more realistic picture of outcomes affected by personality, chance, imperfect understanding, and negotiation. There are lots of different policy models out there, but the one that I'm going to look at is John Kingdon's agenda setting model, or the policy stream model. And this is just one model that depicts a more nonlinear approach to the policy process. And I'm going to look at it because I feel that it looks at the more specifically around the timing and flow of how things link together. Next slide, please, Monica. So Kingdon's agenda setting model looks at the process as having three streams: problems, policies, and politics. And he asserts that the process is about the flow and timing of these three streams. People recognize problems, they generate proposals or solutions for public policy changes, and they engage in civic actions such as voting and lobbying to respond to the problems. Policy change occurs when the three streams come together at a given point in time. In other words, opportunities for policy change arise when a solution is coupled with a problem. You add in a champion or a policy entrepreneur and an open window when there's an opportunity, such as a change in government or a new budget, and something will get put on the agenda. But what are the solutions? Solutions often come from researchers and how their research gets used. In her many writings on the use of evaluation research, Carol Weiss described three main types of research: research as data, research as ideas, and research as argument or advocacy. Different types of research will give you different information that needs to be disseminated or communicated in different ways for different people that have different uses for the research. So now we have the streams of problems and solutions. The solutions are driven by research, and there are different types of research. And now we link this to the people who champion and push for solutions to be on the agenda and advocate for change. And those are often people that work in the community organizations that Florence was speaking to. And we need to link all of this to the opportunity, the open policy window, a change in government, a new budget, a change in public mood, or a crisis or a critical moment, say, for example, a once-in-a-lifetime global pandemic, or changes in climate that create once-in-a-century natural disasters that are now seemingly occurring on a regular basis. But the critical thing here is that none of this is happening in a linear fashion. These things all have an ebb and flow, and there's frequently chance involved, as well as negotiation. Next slide, please. But one thing Kingdon did caution is that policy windows don't often stay open for very long. You need to be ready to advocate for solutions even before the policy window opens. As I see it, people who are trying to advocate change are like surfers waiting for the big wave. You get out there, you have to be ready to go, you have to be ready to paddle. If you're not ready to paddle when the big wave comes along, you're not going to ride it in. And what this speaks to is the idea that people need to be ready for an opportunity. If you're a researcher, you have to have your research ready to go. If you're a champion, you need to have your solution, ideally coupled to the problem, and receptive decision makers ready to go. What Kingdon also suggested is that if solutions are not presented in a timely way, or if they're not presented as being feasible, they fall off the agenda and the window of opportunity closes. Next slide, please. So here, what we've done is try and capture what this means when you're working to influence or change policy. What is your starting point? Where's your entry point? Where is it that you work? Is it research? Okay, what kind of research? Is it research as data, research as ideas, research as advocacy? How will you communicate that research and to whom? How will they use it? Are you a champion? Is there support for your solution? What's the public opinion? Are there others who want to maintain the status quo? Are you connected to the researchers? Can you work with them? Find different ways to communicate the research to different audiences. Are you a decision maker? What is the problem and who defined it? Is there a feasible solution for this? What are the other alternatives? What is the research that provided that solution? Is there a champion to bring this forward? What is the timing for this? Is there an opportunity for this? Is there an open policy window? And underlying all of this is equity and time. Using an equity lens as we work will also help to reveal the power structures within each aspect of this framework. And like most things, change takes time, but you can capture some of the changes as they occur, and I'll speak to that in a couple of slides. But what we wanted to illustrate here is the non-linear way things move, and that there's movement in different directions and that it's all linked together. Next slide, please. So I'll use an example of the work that BCHC does, and I'll talk about how research can offer an entry point. So getting back to Carol Weiss, one type of research that she noted is research as ideas, which is then used as what she called an enlightenment function. And what she was talking about here was that what she was looking at, or what she was seeing, wasn't so much that policymakers were using evaluation research directly, but that the ideas that were coming out of that research and how those ideas percolated and permeated, and then through that way they were influencing policymakers. And BCHC has compiled research on equity, and we developed a collection of tools and resources that we share with our communities that we work with and people who access our website looking for tools. So for example, we have action guides and webinars that we share on our website that we offer to show people how to think about equity when planning and implementing programs, projects, and policies. We also have community grants, and we share our tools and resources with these communities and support them to build capacity in those communities about how to bring equity into the conversation and how to put an equity lens in policies and programs. So each time we work with the community and each time someone accesses our websites and our tools and resources are shared, it allows the idea of equity to percolate throughout the province. In some communities, champions emerge who take the ideas, tools, and resources and make them their own. Over time, our hope is that more equitable policies will become the norm. Next slide, please. As part of our work on equity, we use a fairly simple, straightforward illustration of equality and equity. But what this does is simplify a fairly complex policy concept, the difference between equity and equality, and puts it in an illustration that most people can understand quickly. This is a great example of a dissemination strategy that makes the research and the idea of equity more accessible to more people. Next slide, please. So putting on my evaluation hat, one question that people have is, how will I know if I've influenced or changed policy? So actual policy change is easier to capture. For example, the gender policy for municipality has been modified or updated to be more inclusive. We can see that change. But policy influence is more challenging to capture as part of the change, because often there are things that are happening before the policy change happens. For example, if I go back to using the example of equity again, it's a new concept for many people still, and yet this new idea or concept can reframe old debates, frame new debates, or stimulate public debate. In my past life, I worked with the International Development Research Center, IDRC, which is based in Ottawa. And we worked with Dr. Everett Lindquist, who was at the time the director of the School of Public Administration here at UVic, to develop a framework to help us capture policy influence. We wanted to know, what does policy influence mean and what does it look like? So we worked with Everett Lindquist and we came up with this framework that helps to explain the different types of policy influence that can happen. And we tested and validated it using 22 case studies from across all the different program areas and regions where IDRC works. And the first type of influence that we were looking at was expanding policy capacity. And this is really about creating and maintaining institutional capacity to do the research and analysis and to communicate those ideas to the people. Another type was broadening policy horizons. This is about the conversations that people are having, the networking through various networks. For example, sharing ideas or concepts in the various public health networks or introducing new ideas to frame debates. And finally, the actual changes that occur, modifications of existing programs or policies, or the fundamental redesign of programs and policies. And I think more often what we see here in Canada are the more incremental changes that occur through the modifications of policies, or what Florence was speaking to earlier about tweaking of policies. But sometimes there are new fields of research that open up. For example, back in the day, there was the IT field of research, and that meant the fundamental redesign of communication policies. But what this framework does is it makes the changes that occur before policy modification, or the fundamental changes that occur, you can look at those as being relevant outcomes of the work that's being done. And these outcomes are important parts of the change process that often need to occur first. And this framework provides a way for us to capture those changes, because the policy change that happens probably isn't the whole story. Just looking at that change doesn't capture the networking or the capacity building or the reframing of the reframing of debates with new concepts. And these things are often an important part of that policy change story. It's the influence that we're capturing, not just the change. Next slide, please. So I wanted to talk about what this looks like when it hits the ground. So I'm going to talk about an example from the city of Kelowna. Last year, the City of Kelowna received a $15,000 community grant from Plan H to design and develop an equity framework that they could use to help them make decisions. They wanted to build a tool to support the city's commitment to building an equitable community. This also provided an opportunity for city staff and external partners to build capacity about equity and to make connections. And they also reached out to other communities doing similar work to explore best practices and lessons learned. Next slide, please. So if I was looking at this from an evaluation standpoint and using the evaluation framework, I would see things like conducting and creating use for policy relevant research. That's expanding policy capacities. This is a project that used research around a new concept, equity, and then working with other city departments and with some help from external experts from UBC Okanagan and Interior Health. They held workshops and facilitated discussions to develop the framework. So they were conducting and creating use for policy relevant research. They were also developing new talent for research and analysis. So by developing the framework, they're developing tools for policymakers and decision makers to use in their work. And in doing so, they built the capacity of researchers to develop practical and applicable research that is relevant and useful. And tools like frameworks also provide ways of communicating ideas and concepts in ways that people can use in a timely fashion. Perhaps one of the more influential things that developing this framework did was to introduce new concepts. Equity is still a new concept for many, and how to use an equity lens to frame debates or make decisions often requires a tool to help people to navigate that. So they were broadening policy horizons. And finally, this framework provides a path forward for incorporating an equity lens into new and existing city policies. So down the road, they'll be affecting policy regimes by putting an equity lens on new city policies. Next slide, please. Knowing and understanding the context or the setting that you're working in is an important part of navigating this process. For example, different people you work with will have different perspectives or different understandings of equity in their work. Knowing that and working with those different perspectives will help you to better understand your context. Timing and receptivity is essential. Equity is something that has an open policy window right now, in part because the pandemic laid bare the inequities that exist in our communities and in our society. And because of that, governments at all levels are interested in not just the societal impacts that the pandemic has had, but now how do we make things more equitable? Climate change is another policy window that is open. This affects things like food security, emergency preparedness, and active transportation. And in conclusion, I will also say that understanding the audience and who are you trying to reach is an important aspect of this, as Florence was speaking to about knowledge sharing. What is the best way to reach them? Often policymakers or decision makers want tools to help them to do their work. And finally, I want to share that Plan H community grants are offered every year, and these provide opportunities for communities to work on healthy public policies. And it's also an opportunity for communities to use the tools and resources that we've developed as a way to support the communities in their efforts towards creating healthy communities for all. Thanks very much. And now I will hand it back to Connie.
We cannot hear you, Connie.
Hello, and thank you, Florence and Stephanie. A few highlights from today. I just had great takeaways from your talks. Florence noted that overlaps between public health and local government do not equate to collaboration. Thus, initiatives are required and intentional focus is needed for local government and public health with their allies. Stephanie, thank you so much for the powerful policy tool to serve as a means to navigate healthy public policy pathways. In short, it's great that we can be moving together forward in healthier ways. We recognize our interdependencies and how healthy public policy can change the way we live, work, and enjoy life together. So thank you for your talks. I hope that the audience also had several takeaways. Now we've had several great questions come in, and I will begin to direct them to the two speakers, and that will leave about 15 minutes for that, and then I'll do a wrap up at the end. So thank you for joining us, and we hope that you'll stick around for these questions. One of them that came in, and I'll direct this maybe to Florence, has there been difficulty in changing public policy due to the health professionals suffering from COVID burnout and therefore unable to engage in the conversation?
Yeah, absolutely. And I'd say that even before a COVID burnout, it was simply because of COVID management. So throughout the country, we've seen teams that are usually working on health promotion and promoting healthy public policies that were simply, the focus of their mission was simply displaced. And these people were they were actually redeployed to be on the front line of COVID management, so tracing contacts and things like that. And certainly, I think it's about also my comment earlier that for a long time, not just the start of the pandemic, but for a long time, public health management of this pandemic has been focused on health protection, neglecting the aspects of health promotion, and maybe in more lay terms, all the aspects of how populations were impacted by lockdowns, the impacts on mental health, etc. So one aspect of public health, which was the control of an infectious disease, came to the forefront, and the other aspects of public health were neglected. So certainly, the promotion of healthy public policies has been on the back burner during that time. And certainly some teams are still quite exhausted or have paid a heavy toll. So, but on the other hand, when everyone started talking about pandemic recovery, it became obvious that we had to address the social determinants of health, and that's what promoting healthy public policies is about. So I have hope, but it's been a hard time, certainly.
Yes, I think it's been.
And I'm sure that folks who are joining us today from health authorities can talk about that as well.
Yeah, and thank you so many for the public health with all the 5 different regions for joining us today. So thank you, Florence, for that one. We have another question that came in. Moving forward, what strategies do you recommend for taking this knowledge mobilization concept to my local community board and members?
Is it for me as well?
Could be, or Stephanie, if she's there. Florence, why don't you take this one to start?
Yeah. My answer would be different whether the person asking the question works in a health authority or in a local government. In a health authority, we know that many of the levers for the policies we are advocating for are actually in other government sectors. So there's no other option really than collaborating with these sectors and working in partnership with them to put forward these policies we are hoping will be adopted. From the point of view of a local government, there are win-wins in collaborating with their public health partners. Because of the data, the health partners can bring with them viewing issues and solutions from a different angle. Also, literally in terms of resources, like joining forces, because local governments, especially the smaller ones, are struggling. So looking for collaborations that can help bring in more expertise and more resources can help. So it's a partial answer to that.
Thank you for that, Florence. And I'm not sure where Stephanie went, but I do have another question here that came on from one of our participants, and thank you for this. Really, this one is, I'm wondering how Indigenous cultural safety, truth, reconciliation, and action against Indigenous specific racism fits with an equity approach. And I guess the question was, does Indigenous cultural safety, truth and reconciliation and action happen with this in our partnerships?
So thanks. Yeah, that's a great question, and I think with how BCHC approaches equity and equitable engagements is that what we encourage the communities that we work with to do, and how we support them is by asking them who are those people, who are the voices that you want to reach, who are those voices that are often underrepresented or not represented at the table, and do you have ways of reaching them? Again, you know, that's working in collaboration with community organizations, grassroots organizations, often, and it's not just asking them to participate, but it's also when you approach them, how they want to participate, and looking at how they want to participate. There's probably some fatigue around lots of the smaller communities and Indigenous communities in terms of wanting to participate or wanting their participation in truth and reconciliation programs and projects and policies. And as they struggle as well through COVID, and we've had several, you know, climate change, natural disasters, flooding, wildfires here in BC as well. So it's asking them how they want to participate, if they want to participate, and to allow them the opportunity to bring their voices to the table the way they want to bring their voice to the table, and in a way that makes them feel heard and safe. I think that's where we would start when we work with our Indigenous communities.
Thank you, Stephanie. I don't know if Florence, you want to add to that conversation?
No, I think I think Stephanie provided a really good answer.
I agree. Thank you so much, Stephanie. There is one specific to you, Stephanie, is that how do you see this BCHC policy tool being used for local Indigenous groups to build relationships? Kind of a follow-up question, I guess.
Yeah, no, that's a great answer. And I would actually answer that by asking anybody working in an Indigenous community, as part of an Indigenous community, to reach out and work with us and to let us know whether or not these policy tools are helpful and useful for them in terms of how they work. There may be things that may not be it may not look the same for them as they work through and depending on how they work. And I think that would be great for them if they wanted to reach out. But really, these tools are meant for people to sort of look where they're working and map out where they're working, and then maybe make the links and see where they're linked in and where they maybe there's gaps, and they could maybe reach out and create new relationships and collaborations so that there's feedback loops going in all the directions, and the feedback happens different ways and different directions. But really, we would love to hear from anyone that would have any feedback for us in terms of that, those links to the Indigenous communities, for sure.
And one last question as we close off today, I'll throw it out to both of you. Given information is a source of power and access to research and evidence is readily available, how does one discern the accuracy? And specifically, how does it apply to my local community when we attempt to make policy change to the outdated ones?
I guess I could start with that. I think that it's interesting because data and evidence is contested, I think, in some ways, or it can be. And we work with lots of communities and at the community level. And I think it's important, particularly when we work with our smaller communities and our Indigenous communities, that we value the qualitative community evidence that comes in, and that having their voices heard is also a source of power and access. And I would say that that's just as accurate as any survey data. And we can use that evidence. I mean, there's lots of qualitative evidence that we can bring to the table. When I was working, I did one of the case studies with IDRC, and we interviewed, I think, over 50 people in various different levels of government and part of the Ministry of Health, as we looked at whether or not a project in Tanzania was able to influence policy. And it was, a lot of that was just through qualitative interviews and listening to what people were telling us and making the links between how they were able to use the tools that were produced in a research project, and, you know, following the use.
Thank you, Stephanie. I'll close off the questions now. And I guess one of the things that we have data coming in already from our Plan H 2021 communities, and several of them have given us those kind of local evidence, and particularly some of the ones that are storytelling and sharing some incredible data that's happened in their community related to healthy public policy. So we thank you to them and shout out to the different communities that have done that. And we encourage any others to share their stories with us. And it's been amazing to see how many are represented today in the Plan H and the age-friendly community. So hope that your project is going well. And if you need any support, if you were intrigued by our presentation today, visit the Plan H website, reach out to one of our staff members to give you a hand in your project, search the National Collaborating Center policy website, access previous HPP webinars, and stay tuned because 2023 will bring more. We hope that you apply for grants if you haven't already received one. And finally, in wrapping up today, thank you to all for attending. Please ensure that you can complete your survey that'll pop up at the close of the survey, at the close of the webinar. And we'd be delighted to get your feedback. We hope that you have several takeaways from today's session, along with one action step that you can do in the next 48 hours. And just to close out, we provide the contact information for our slides and for our two speakers today. So feel free to reach out to both of them and myself if you have any other questions. We will be providing the copy of this webinar along with all of our resources, and that'll be up on our website later today. We'll probably send out the thank you email for attending early next week, so that you'll actually have it to be able to share with others, and that we hope you are successful in your local communities in implementing healthy public policy pathways. Last word, Stephanie or Florence?
No, I think that was great. And I thank everybody for joining us today. And I hope that you enjoy the rest of your day. And don't forget to let us know how you felt about this webinar and fill out our survey. Thanks.
Thanks,
Thank you. Thank you, everyone, for participating.
And thank you for joining us today. We really appreciate your support for BCHC and Plan H. And we look forward to hearing and seeing you at our future webinars in 2023. Good day.